Korean Kinetic Acupuncture demonstration videos taken from parts 2 and 3 of Korean Kinetic Acupuncture. Hands, wrist, finger begins at 30 seconds. Tennis elbow begins at 12 minutes. Golfer's elbow at 17 minutes. Triceps 22 minutes. VSD neck shoulder 28 minutes. Foot problems calf 36 minutes. Anterior tibialis 49 minutes. The knee 56 minutes. Hip IT band 1 minute, 1 hour 1 minute. Piriformis 1 hour 3 minutes. TLT 1 hour 5 minutes, and lower back decompression 1 hour and 7. To find the trigger points, you stretch the muscles, you extend the hand back, you're stretching these muscles, and then you massage, and you find the tender points of the area. Right now I'm working on the flexor carpi radialis, the medial palmaris longus, and flexor carpi ulnaris. Now these are on the medial side. You can place needles here. There's some knots here and here according to the instructions in the book. You may want to also place needles in the brachioradialis, although this is not a wrist flexion muscle. So once the needles are in, we do this exercise. The practitioner will extend the hand back, and they instruct the patient to lift the hand up at the count of 4. So go ahead, lift your hand up, 1, 2, 3, 4, relax. Lift your hand up, 1, 2, 3, 4, relax. Lift your hand up, 1, 2, 3, 4, relax. So the patient is lifting their hand up, they're contracting these muscles, but the practitioner resists that movement. These muscles contract to move the hand, but the hand doesn't move, so these muscles will stretch. You can repeat this exercise between 5 and 10 times. Now we'll work on the posterior forearm. We will stretch the muscles by flexing the hand. You can check for the trigger points. The trigger points are along the extensor carpi radialis longus, the extensor carpi radialis brevis, and then also on the lateral side is the carpi ulnaris lateralis. So you extend the hand down, find the trigger points here, you insert the needles according to the instructions in the book, and then you're going to instruct the patient to lift the hand up, but you're going to resist that motion. So lift the hand up, 1, 2, 3, 4, relax. Lift the hand up, 1, 2, 3, 4, relax. You can repeat this exercise 5 to 10 times. And again, these muscles contract to extend the hand. The practitioner is resisting that. These muscles contract, the hand doesn't move. It'll stretch the muscles, and it'll eventually relax the tendons here, giving benefit to the hands and fingers. Okay, just right around here. Up more. Feel with the fingers and insert the needle. Good. Insert. Good. Feel with the fingers, palpate the muscles, the trigger points. Good. Insert. Good. Play around with it. She's feeling for the trigger points. Insert. Okay. Okay, very good. So we're working on the muscles here. Let's do the procedure. Now you can do needles all up and down, wherever you feel the trigger points in the arm. So we're going to extend the arm. Now, first thing, you can relax. Check, hold on to my arm. Check the patient's comfort with the needle. Hold. Up and down. Is it okay? Okay. Now go back down. Now fully flex the muscle as much as possible, and then instruct the patient to lift their hand up, but the practitioner is going to resist. So I'm lifting up. Lift up, resist. 1, 2, 3, 4, relax, and return back to stretch. And then repeat. Lift the hand up. 1, 2, 3, 4, relax, and then return back to stretch. you'll see the needles kind of moving. Okay, lift up, 1, 2, 3, 4, relax, and then lift up, 1, 2, 3, 4, relax. So this is an isometric stretch. We're stretching these muscles with the needles and the trigger points, and then we lift up. These muscles contract to lift the hand up, but she's not letting it. So the only option is my muscle is going to stretch here. Okay, we'll take the needles out. Okay, good. Now we're going to do extension of the arm on the medial side of the forearm. And let's go. Same procedure, just on the medial side, on the muscle trigger points here and here. Good. There's a little jump there. That was good. I don't know if you can see the needle there. There it is. You can see it against the chair. It's right there. This is my wife. She's a licensed acupuncturist. So make sure you are a licensed acupuncturist to do this procedure. Then the second needle is right there. You can see that there. There's 2 needles. Okay. 3 needles. You can see them. It's better that way. Okay, and then do a couple more on the inside of the arm. You'll see there on the lateral side and the medial side. We can do a couple there. A couple more. Wherever you feel the knots and the trigger points, you can do the acupuncture. She's going about 1 to 3 chun in 0.1 to 0.3 chun in depth. Very safe as long as it's on the muscles. And she's feeling for the trigger points, the knots. Okay, hold my hand next. Just hold my hand. Okay, so let's check the comfort level of the patient. You move the patient's hand up and down. Are they comfortable? Now, there's a little dimple here. I don't know if the camera picks it up. So it's a little painful maybe for the patient. So you just take it out a little bit. And I took that one up by accident. And if it hurts the patient, you can just take them out a little bit. Okay, but my comfort level with the needle is fine. So we're going to begin the kinetic acupuncture with an isometric stretch. We're stretching these arms. My hand is down. Now I'm going to lift up. You instruct the patient to lift up the hand, but the practitioner resists. 1, 2, 3, 4, relax, and then return back to full stretch. And then lift up. 1, 2, 3, 4, relax, and resist, and return to stretch. And then lift up against 1, 2, 3, 4, relax, and return back to stretch. And again, 1, 2, 3, 4, relax. So I can do this from 5 to 10 times per patient, per body part. Okay, that's good. So I'm going to take the needles out. And then following this, we do the fountain of youth stretching with the patient. And we're going to do the fountain of youth stretching, and I'm going to do a pull on the muscle while the muscle's in a stretch technique. We'll be doing that next. Just hold it. Okay, perfect. Okay, so we are doing the fountain of youth stretching for the lateral side of the forearm. We instruct the patient to lift their hand up and keep the elbows straight, bend the hand, and then with their other hand, they're going to pull up on the fingers there, pull up, but they're also pushing down here. So they're pushing down and pulling up. Now, while they're putting these muscles in a stretch, the practitioner can pull down on the muscles. Now, we can get the tennis elbow area here and just pull on the muscle. Do you feel a stretch? Okay, she feels a stretch. And you just pull on the muscle while it's in a stretch. So you put the muscle in a stretch, and then you pull down on that muscle. So this is a fountain of youth stretch. We recommend to do these stretches as a set of 2 to 3 times per set. And if the patient's doing it by themselves, just hold for 15 to 30 seconds. But the practitioner can further accentuate the stretch by pulling on the muscle when it's in a stretch. Let's do the other one just real quick, the other way. Okay, this is the fountain of youth stretching for the medial side of the hand. We're stretching the medial side, the inside of the hand, to benefit the wrist here and the fingers here. So what we're doing is we're going to bend down here, and then you have the patient lift the fingers up. Okay, good. Can you see that? And then we instruct our patients to hold this position. Their hand is just off the table. It's not completely on the table. They're pushing down here at the wrist as they're lifting up on the fingers there. And we're stretching these muscles here. Now, while they're doing that, I'm going to take my hands and pull on the muscle from underneath. So I'm pulling on the muscle from underneath here. And you can really grab, pulling on the muscle. Just kind of walk down. The muscle's in a stretch, and then you pull down and stretch. One other trick for arthritis, keep the position. For any arthritis on the fingers, you can have the patient press on the knuckles. They lift the finger up and then press on the knuckles. And this is good for arthritic developments of the fingers. You can feel you can feel the muscles stretching under the finger. So we're stretching these muscles, the medial side, to benefit the wrist and the fingers. This concludes the Korean Kinetic and Fountain of Youth stretching procedures for the wrists, hands, and fingers. We're going to move up to the elbows next, and we will work on tennis elbow. This is a demonstration video for the book Korean Kinetic Acupuncture Techniques. Next, we'll do some muscle release, trigger point release for the elbow. We will begin on the lateral posterior part of the elbow, with which the flexor and supinates muscles, which is primarily the brachioradialis and the brachialis. You can insert your needles, and you want to kind of put the muscle in a stretch here. You can insert the needles anywhere along the muscle here, and then you can ask the patient to supinate and flex the elbow. It's going to turn. It's kind of a backward arm swing in tennis, a backward tennis swing. So you're going to resist that motion. So go ahead and lift your arm up. 1, 2, 3, 4, relax. Return to the stretch position. 1, 2, 3, 4, relax. Return to the stretch position. 1, 3, 4, relax. So these muscles are contracting to flex and supinate, but you're resisting that, so these muscles will stretch. This can provide relief for tennis elbow. Okay, we are going to do tennis elbow demonstration with kinetic acupuncture. So most of the tennis elbow is on the brachial muscles here. So we're going to be going down a little bit on the line, but you can go a little bit above too. The patient usually has a complaint in this area here. So let's start with the, LI 11, 12. Okay, go ahead and do the acupuncture. I can do it if you want. Okay.
This muscle?
Yeah, LI 11, 10. LI 11, 10. Good. You can see that muscle against my black shirt. There. That's on LI 11 approximately. We'll do LI 10. Good. Feels good. No pain. More around. You can do around then. You can, and then we'll be doing ashi points. This is LI 12.
We can do local around the epicondyle. You can have the patient point, like, where is it? There's some pain over here, say. You get it around that epicondyle. And again, you can go about 0.3 chun in. Okay, so we're going to check now. The needles are kind of around the area. Now what we're going to be doing is, I'm going to be doing two things. The first thing is, I want to stretch these muscles. So I'm going to bend my hand. I'm going to flex the hand like this. And then what we're going to be doing is like a backhanded tennis movement, where I'm going to be doing a backhanded swing against the resistance. And we can do it at different angles. Like I can lift my arm up here, or I can extend it more, but my hand is always going to be flexed. So my wife's going to be resisting. Hold it this way. She's bending the hand down. She's holding it down. And then I'm going to move up. 1, 2, 3, 4. Relax. And then return to stretch. And then 1, 2, 3, 4. Relax. Return to stretch. We can go up a little more elbow flexion. And then this way, don't push, resist. 1, 2, 3, 4. Relax. And then go down and full stretch. Go ahead and push down. Or okay, now I'm going to pull up. 1, 2, 3, 4. Relax. We can go from here. 1, 2, 3, 4. Relax. We can almost extend it more. 1, 2, 3, 4. I'm pushing up and in. I'm backhanding my hand, and the elbow's flexed. And then the same stretch, the fountain of youth stretch that we did for the wrist and fingers, we can do the exact same stretch for tennis elbow. It's a really good stretch for both the wrist, the fingers, but also for tennis elbow. And keep the elbows straight, bend the hand, and then with their other hand, they're going to pull up on the fingers there, pull up, but they're also pushing down here. So they're pushing down and pulling up. Now, while they're putting these muscles in a stretch, the practitioner can pull down on the muscles. Now, we can get the tennis elbow area here and just pull on the muscle. Do you feel the stretch? Okay, she feels a stretch. And you just pull on the muscle while it's in a stretch. So you put the muscle in a stretch, and then you pull down on that muscle. So this is a fountain of youth stretch. We recommend to do these stretches as a set of 2 to 3 times per set. And if the patient's doing it by themselves, just hold for 15 to 30 seconds. But the practitioner can further accentuate the stretch by pulling on the muscle when it's in a stretch.
On the medial side, we're going to work primarily with the pronatus muscle here, pronatus ternaris. This muscle pronates and flexes the arm this way. So this is kind of an arm wrestling. Keep the arm straight and then insert the needles here. And you're going to have the patient do like an arm wrestling motion, but you're going to resist that motion here. So go ahead and lift up. 1, 2, 3, 4. Relax. Go ahead and lift up. 2, 3, 4. Relax. Go ahead and lift up. 1, 2, 3, 4. Relax. The patient's trying to do this. You can do it from different level. Go ahead and push in like that. 1, 2, 3, 4. Relax. 1, 2, 3, 4. Relax. This is to provide benefit to the medial side of the elbow for perhaps golfer's elbow.
We're going to do golfer's elbow next. Golfer's elbow is kind of pain on the medial side of the elbow here. Tennis elbow is on the lateral side, but we're going to do the golfer's elbow. The patient has pain complaint in this area of the elbow. And we're going to do a kinetic procedure with this one. Good. Okay, go ahead. And she can do anywhere in the local ashi points. Hurt. Okay. A lot of times patients will point to around the epicondyle there. So you can do it around the tendon areas there. Okay, gently, good. Alrighty, good job. maybe down here between the epicondyle of the elbow.
It's hard to.
Heart 9 is right there. Heart 9's here. So we're almost on the small intestine channel there. Okay, that's good. Don't put in anymore. That's fine. Right there. Okay, and then how about right up here? I got some pain kind of on this side. We're going to be working mostly on these muscles here, actually, with golfer's elbow. Right there. Alrighty. Good job. Okay, we're going to do the kinetic procedure. So, that's good. Okay, so my wife's going to take my hand. Now what we're going to do is extend the hand. We're really working on these muscles here, and we're going to arm wrestle. So she's going to extend my hand back as far as it goes, and then we're going to arm wrestle, and I'm going to push forward like that. 1, 2, 3, 4, relax, and then return back to stretch, and then push up. 1, 2, 3, 4, relax. And then my hand is extended. Now we can do different angles here too. I can lift up 1, 2, 3, 4, relax. And up and in, 1, 2, 3, 4, relax. So we are resisting the motion. 1, 2, 3, 4, relax. And then up and in, 1, 2, 3. So you can almost extend the arm very much and then go up and in, 3, 4, relax. And the hand is extended. Okay, 1, 2, 3, 4. I'm pushing up on the arm, but she's resisting. So we're contracting these muscles. We're stretching these muscles right now. And then I push, I contract these muscles, but the hand is not moving. So the only option is they should stretch there. 1, 2, 3, 4, relax. Okay, and the same fountain of youth stretch that we did for the wrist here also applies to the elbow. Down here at the wrist as they're lifting up on the fingers there, and we're stretching these muscles here. Now while they're doing that, I'm going to take my hands and pull on the muscle from underneath. So I'm pulling on the muscle from underneath here, and you can really grab, pulling on the muscle. Okay. Pull down. Just kind of walk down. The muscles in a stretch, and then you pull down and stretch. Okay, this is Korean Kinetic Acupuncture sample demonstration video to support the book. This is a triceps procedure, which the triceps muscle is located here, and it extends the forearm. So if somebody has limitation on how much they're able to flex, it may be a result that the triceps muscles are short here, and it provides an inability to fully flex the arm. So for this procedure with the acupuncture, we begin by stretching the triceps, and then we're going to also flex the shoulder. The triceps is stretched. We check for tender area points here, and then you can insert the needles along those tender areas of the triceps. Once the needles are in, you're going to test the patient's comfort level by moving the arm. Once the patient comfort is assured, then you're going to ask them to lift their arm up like this, but you're going to resist that, and the triceps will contract to lift. But since you're resisting, the arm doesn't move, the triceps will stretch. So go ahead and lift your arm up. 1, 2, 3, 4, relax. And keep the shoulder flexed, keep the triceps stretched. Lift the arm up. 1, 2, 3, 4, relax. Again, lift up. 1, 2, 3, 4, relax. Again, 1, 2, 3, 4, relax. You can repeat this exercise between 5 and 10 times, and then take out the needle. Okay, we're going to do a triceps kinetic acupuncture procedure to stretch the triceps muscle. This is good for pain on the back of the elbow, where the tendons attach into the back of the elbow, and they're stretched tight due to the short triceps. So we're going to clean the area. She's going to find the trigger points. You can see that needle right there. And you just find the trigger points all up and down the triceps, maybe one more. We can do 3 to 5 or 8 needles. Okay. Okay, next we're going to check the comfort level of the patient. You can have them move their arms. Grab hold of my arm. Stand over there. Grab down here. You gotta grab down here. Okay, so first just check the comfort level. Okay, feels good. So we're gonna put the triceps muscle in a stretch. We're stretching the triceps muscle here, and then I'm gonna push up my arm here, but she's gonna resist. So push up 1, 2, 3, 4, relax, and return back to stretch. And you can also lift the arm up high above the head. And then from this high up position, push 1, 2, 3, 4, relax, and then return to stretch. Push up, 1, 2, 3, 4, relax. So when the elbow is high up, we're really stretching from here to there. 1, 2, 3, 4, relax. And then again, one more time. 1, 2, 3, 4, relax. And then we'll do the fountain of youth stretching next. Take the needles out. Okay. Okay, we're stretching the triceps with the fountain of youth stretch. You can pull on the muscle, so the patient's putting the triceps in a stretch, and then you just pull on the muscle while it's in a stretch. This is stretch number 1. This is the fountain of youth stretching for the triceps muscle. This is what we instruct our patients to do after we've done the treatment. This is good for triceps. This is good for the teres major. This is good for peripheral nerve impingements that come down the back of the arm to the hands and fingers. So this is a definite one for any kind of peripheral nerve impingement that goes down the back of the arm to the hands and fingers. So to simply stretch, touch the back, don't move, and just push against the wall. Push your arm against the wall so that the triceps is flush against the wall. And then just push against the wall. So this is the fountain of youth triceps and teres major muscle. Again, good for peripheral nerve impingements on the back of the shoulder, going down the hand, and triceps and elbow pain. This concludes the chapter on kinetic triceps procedure. Next, we will work on kinetic shoulder procedure, which includes VST, vertex synchronizing technique of the neck. Okay, so we are doing VST acupuncture for the neck vertex. We're going to start on the trapezius muscle, and we are just going to work our way down. The trapezius muscle inserts into the back of the head here, and it's like a diamond-shaped muscle into here and then down to here. Any kind of pain on the back of the neck or headache pain is probably from muscle tension of the trapezius. So you insert the needle, and then you push and probe, and you just push and probe with the needle. And then we can do the all up and down the trapezius here. And then after doing the trapezius, we go into small intestine 13, and that's at the medial side, the upper medial side of the scapula. This is the levator scapula muscle. You insert obliquely, not going too deep, 0.3 chun. With this, when you needle the trapezius, you can grab it with the fingers, and you can needle between the fingers. And so you're not going to get a pneumothorax when you're needling on the trapezius, which is held between the fingers. And then you can push and probe with the needle. I leave the needles in after inserting. And so then we're going to move up to the first of the rotators, which is the supraspinatus here. I do an oblique insertion on the supraspinatus, and then the other rotator cuff muscles located here. This is infraspinatus, You can push and probe with this. We get a lot of muscle twitching over here, a lot of peripheral nerve impingements from pain going down the back of the arm, maybe from the infraspinatus, and also the teres minor, which is in line with the crevice where the armpit goes into the shoulder. We get a lot of muscle jumps and twitches on the teres minor muscle here. And then if you noticed an arm length difference, we can do teres major release, and you just grab the muscle between your fingers and you can go all up and down the teres major. There's one more shoulder rotator cuff that we can do, and that is the subscapularis muscle. And for that, you bring the arm back behind you. The scapula will wing up, and then you can insert the needle oblique, it's actual perpendicular, and go right under the shoulder blade there, and you're getting the subscapularis muscle. You can work your way all the way up from the lower to the upper shoulder blade. I do not retain these needles. This is a quick needle technique. And then after doing, we take out. So for the VST vertex, we needled along the trapezius, levator scapula, infraspinatus, teres minor, subscapularis. For arm length difference, teres major. And then, of course, you can always do the traditional acupuncture points. We like to do GB20 and GB21, the urinary bladder point lines, small intestine lines. So you can incorporate VST with traditional acupuncture points. TCT, therapeutic cervical technique. We do 4 motions. Now, you're not going to see them very well. On the first one, actually, I have another video that demonstrates what we're doing much better than you can see here. But we're just pushing on the vertebrae side to side with our fingers, and we're walking up and down the vertebrae, the cervical vertebrae of the neck. You don't have to look at the camera. Just relax. Okay, and we just push side to side. Does it feel good? Don't make it run. Okay, push side to side, and then we can do it with our fingers, and we do pushing on each vertebrae. And you walk up and down the vertebrae. You're stepping up the vertebrae and down the vertebrae, side to side. And the most common of the TCTs that I do, therapeutical cervical techniques, is a stretch of the traps. And you just stabilize one hand on the shoulder, you turn your head, and then you don't push, just stabilize, and then you lift and turn, and you hold for, I hold for about 15 seconds. And then you do the other side, grab underneath, stabilize, you're not pushing, lifting up. I count to about 10 seconds. I like to repeat these. I do them twice. You're holding under and just stretching the traps. And then one more time. And then TCT number 4 is a neck traction, and you just pull. 1, 2, 3. 1, 2, 3. And then the last, actually TCT number 4 is when you have them rest the occiput on the fingertips, and you'll feel the suboccipitals just begin to melt like butter. So this is the last of the VCT. After doing VST for the neck, we do TCT, and then this is how we finish it. And the patient just relaxes their head, and they should feel the muscles begin to melt like butter under the fingertips.
Insertion depth. This is the Korean Kinetic Acupuncture sample demonstration video for a kinetic shoulder procedure. In this example, we do traditional acupuncture upon the points of the shoulder here, and while the points are inserted, we do a gentle rocking back of the shoulder, and we do this for about a minute, 30 seconds to a minute. The patient's shoulders relaxed. We're rocking the elbow laterally and medially as we also rotate the shoulder, flexion and extension. And then part two of this is we abduct the shoulder as far as the patient's comfortable. The needles are still in place. And then we instruct the patient to push down. Push down. 1, 2, 3, 4. Relax. We lift the shoulder up. Lift down. 1, 2, 3, 4. Relax. We lift the shoulder up as far as the patient's comfortable. And then they push down gently against the resistance here. Push down. 1, 2, 3, 4. Relax. You can repeat this about 5 to 10 times. 1, 2, 3, 4. Relax. Gently lift the shoulder down again, and you can rock, and then take out the needles. It's using kinetic acupuncture, and it's for the treatment of plantar fasciitis. Kinetic acupuncture, I learned this technique from Dr. Hyung-Suk Choi, the chief practitioner of Hamso Children's Hospital in Los Angeles. This is for the treatment of plantar fasciitis with kinetic acupuncture. First, as most any procedure on plantar fasciitis will involve some form of stretching exercise of the gastrocnemius and the soleus. There's hundreds of stretching videos online. Now, we are going to incorporate one of those stretching techniques with acupuncture, and that's what defines kinetic acupuncture. Kinetic acupuncture is movement of joint or limb while the needles are inserted. Now, today's demonstration, I'm not going to be actually inserting needles. This is just a simulated demonstration of the technique. Plantar fasciitis is defined as pain on the bottom of the foot or pain along the heel, or Achilles tendonitis. So, as part of the kinetic acupuncture technique, which may be technique number 1 that you use, you're not going to be needling down here. Later you can go and do a local needle. But for the kinetic acupuncture, the work is going to be done here on the calf muscle. Now, before we begin, we have to explain why. Why do you get plantar fasciitis, pain at the bottom of the foot or pain at the heel? The answer is in trigger points. Trigger points. Trigger points are the clusters or the knots within a muscle tissue. If you ever get a massage and you have a knot, they say you have a knot, that is a trigger point in the muscle. And as a demonstration, if you have a piece of rope and you tie a knot in the rope, it shortens the length of the rope. So if you get a knot in the muscle, it shortens the length of the muscle. This muscle becomes short, the tension on the Achilles tendon becomes more stretched, there's more friction involved, the tendons underneath the foot also are pulled. There can be inflammation or calcification where these tendons stress against another tissue. So the treatment for kinetic acupuncture strictly involves on the calf muscle. Now, when the patient comes to your office, how do you examine them and how do you make the diagnosis that the problem is here? It's a very simple demonstration. We're going to ask the patient to put their muscle in a stretch. And the knots, to find the knots and the trigger points, we're going to rub our finger upward against the movement, against the muscle, while the muscle's in a stretch. So at this point, I would take some Sombra cream or gel, whatever kind of oil, and I ask the patient to stretch their muscle, okay? So this is a calf muscle stretch. Now you take the oil and you rub it up the muscle. How do you know if this is the problem? This will be painful to the patient. By just pressing your finger, the patient will have pain. Number 2, you will feel the knots in the muscle. You'll feel the knots on the medial side of the calf muscle. The knots can occur anywhere from the lower to the upper gastrocnemius, but it's typically on the inside muscle. So at this point, by running the finger, the patient has pain and you feel the knots. you can be certain that the problem is here. The muscle became shorter because the knot is a tangle and cluster of muscle tissue that shortens. The Achilles tendon stretched and all the underlying tendons. So we want to release these trigger points. We want to relax the muscle and stretch the muscle. If the muscle is more stretched, then there's less tension on the tendons and the underlying tendons and tissue. The patient should experience alleviation of pain after the treatment. Okay, so at this point, after we have diagnosed the knots, you found the knots, we begin to do the acupuncture. And wherever there's a knot, now remember, keep the patient in the stretch position, okay? So the patient remains in the stretch position with the needle insertion. We find the trigger points and we insert the needle. You can do a little probing to the side, in and down, but you do not want, okay, so that's a little probing into the trigger point. Now, as you continue to do them, the patient may experience pain, and part of this procedure may be painful. So what you want to do is you want to just have a shallow or superficial insertion of the needle in the skin. I repeat, you want to remain the needles with a shallow superficial insertion, maybe 0.3 chun as part of the needle. Okay, so I've done my acupuncture. I probed a little bit into these trigger points, and anywhere from, a few needles to 8, less than 8 needles. Anywhere with these knots. The needles remain in place, and while the needles are in place, you're going to ask the patient to do an exercise. So first, to test, you ask them to stand up and down on their foot. So just stand up and down on the heel. You'll see they lift the heel up while the needles are still in place. Up and down, up and down, up and down. So you'll see when you get the needle, you'll see the needles move. As she lifts up, the needles will go up and down. That's helping to break up the trigger points in the tissue. It creates a circulation of blood and oxygen to the muscle. That's what the trigger point does. It restricts the circulation of blood and oxygen to the muscle, shortens the muscle becomes a beef jerky-like consistency. Becomes very dry and stringy. That's what the presence of trigger points does. So these needles help to break up these trigger points. Now, as she's lifting up and down, you're going to add a resistance, and this becomes an isometric exercise. So as she lifts up, you're going to resist that motion with your hand down here. This is an isometric stretching exercise. So put the muscle in a stretch, and then add the flexion, but with resistance. That's going to help stretch the muscle. Okay. Now, while the needles are still in place, you can have the patient twist her foot. You can have her stretch whichever way so that she can stretch where the areas of the needles are inserted. So with your foot on the ground, just turn your leg to the side. You can twist and bend. You want to stretch the area of the needle. And then finally, lastly, as a last stretch, you can bring the foot forward, and with your heel this way, lift up your toes. Lift up your toes. So right now she's doing this. She can also bend forward and get a stretch. She can bend forward and get a stretch on these. While she's in this position, you can stretch on this part of the leg. Okay. All right. So this is just a simulated demonstration of the acupuncture technique. As a word of caution, it can be a little bit painful, but the patients will notice a result right away. This is part 1. Then you can begin part 2 of whatever therapy you use. You can do some local points down here after that. So this has been a demonstration of kinetic acupuncture, and any questions, you can look it up. This is a Korean Kinetic Acupuncture sample demonstration video. This is a video to demonstrate the calf muscle procedure. So we instruct the patient, before the needles are inserted, we instruct the patient to be in a standing position and bring their foot back as far as possible so that the heel is touching the ground. In this position, the calf muscle is stretched. And then we massage going upwards to check for the trigger point tender areas. You want to be careful. Just on touching, even lightly touching, can be very uncomfortable and tender for the patient. And it may surprise them. They may get sweaty, faint, they may pass out just by touching. So there's some tender areas, and where they're at, we'll insert the needles. That's the trigger point areas. So there's two procedures with this technique. The first procedure is that once the needles are inserted, we're going to ensure the patient comfort by asking them to stand up on their toes. They're going to lift their heel off the ground. Go and lift. So by doing that, it flexes the calf muscle to lift the heel up off the ground. The needles are in place. The patient comfort has been ensured. So this is procedure number one. We just simply ask the patient to stand up, lifting their heel off the ground, and we resist with our hand here at the base of the heel. So go ahead and stand up. 1, 2, 3, 4, relax. Go ahead and stand up. 1, 2, 3, 4. Now, as I'm holding here, you can actually press down and counter that force pretty well. Lift up. 1, 2, 3, 4. So I'm stretching the calf muscle here. This will stretch the tendon of the Achilles and all the tendons underlying the carriage of the foot. It will relax the tendons and the tendons under the foot. So that's procedure number one. They stand up and you resist. You can do that 5 to 10 times. Procedure number two, we ask the patient to bring their foot back even further so that the heel's still touching the ground. So bring your foot back further. Heel's touching the ground. Now the patient hasn't been instructed. They're going to push against the wall. And as they push against that wall, that force is going to pass through their entire body and is going to drive the heel further into the ground. And that's going to further stretch the calf muscle. So patient pushes against the wall. That drives the heel in the ground. The practitioner can support that by pushing down. The needle's still in place, and the needles are usually on the medial gastrocnemics, the medial calf. We hold this procedure for 20 seconds. So after 20 seconds has passed, then I usually repeat procedure number one again. I instruct the patient to stand up. Go ahead and stand up. 1, 2, 3, 4, relax. Again, stand up. 1, 2, 3, 4. You can do this procedure 5 to 10 more times. Take out the needles. There's one variation for Morton's neuroma, which is a pea-sized nodule on the bottom of the foot under the balls of the toes. While we're in procedure number two, while the patient's foot is as far back as possible, we can lift up on the toes with our hand. We can lift up the toes, and this will stretch the underlying tendons of the foot and the toes while they're in that 20-second stretch with procedure number two. So you can simply lift up on the toes, which will provide a further stretch for the whole calf, Achilles, and undercarriage of the foot. This is the fountain of youth stretch for the calf muscle that benefits the bottom of the foot. This is the last thing we do after performing the Korean Kinetic Acupuncture techniques, number 1 and 2. So it's just a manual stretch. We've already had the patient bring their foot back as far as possible. They push against the wall, driving the heel on the ground. The calf muscle is stretched. Now, in that position, we do the pull on the muscle while the muscle is still in a stretch. So they can push against the wall, letting the force pass through the body, driving the heel on the ground. And then what you can do is just take your fingers and pull on the muscle. Now you can position yourself. What I find the best way to position yourself is to go from above, and then you can use your body weight to pull down the hand. Can you feel that stretching there?
Yeah, ouch.
Okay, and you just walk your hands down, especially the medial side of the calf muscle. So you're just pulling on the muscle while it's in a stretch, and you just walk down. So this is the last thing we do with the patient after performing the Korean Kinetic Acupuncture techniques. Alrighty. This is the Korean Kinetic Acupuncture technique for treating the anterior tibialis muscle, which benefits all kinds of pathologies on the top of the foot. This muscle can get short. The tendons become more stretched. They can pull the toes up, causing arthritic toe development pains because the tension on the tendons is too tight. There can be peripheral nerve impingements where the short muscle or stretch tendon pinches on the nerve, causing numbness and tingling pain. So we're going to do the Korean Kinetic Acupuncture technique first, and then we're going to do fountain of youth stretching. There's 2 fountain of youth stretching, and we teach the patients how to do this. So the first thing we do is to check for the presence of trigger points on the anterior tibialis, and we do that by, now what we do is we put the muscle in a stretch. So we're going to bend the foot down as much as the patient's comfortable, and then you can check for the tender trigger points along the anterior tibialis, and there's a few knots here, painful there. So that's where we're going to put the acupuncture needles. You okay? Good. Okay. Okay, so you put the foot in a stretch, you find the trigger point, and then you can insert the needle 0.1 to 0.3 chun. There's a little jump there. Not a bad response, the muscle twitches. It can be painful for the patient, so you always want to check the patient comfort level. And we just kind of walk up and down the anterior tibialis muscle. These are points along the stomach and gallbladder channel and along the trigger points. Are you okay? Okay, so we're going to begin to check the patient comfort level next. So I'm going to check the patient comfort level to make sure the needles are not hurting the patient. If you notice any dimples in the needle, that may be uncomfortable. So to check the patient comfort level, we move the foot up and down. Are you okay? Okay, up and down. Okay, it's a little uncomfortable for the patient, so I'm going to take the needles out just a little bit. Again, these are sitting at about 0.1 to 0.3. Is it better now? Okay, so she says it's better. Okay, now what we do is we put the foot in a stretch. So we're stretching the anterior tibialis. And then, let me take it out a little bit more. She's a little uncomfortable there. Okay, so that's better now, right? Okay, now I'm going to ask the patient to lift the foot up in this direction. Go ahead and lift. Lift up. 1, 2, 3, 4. Relax. So we're putting this muscle in a stretch. We ask the patient to lift up, lift up. This muscle contracts to move the foot up, but I'm not letting it move. So the only option is this muscle should stretch. And we do it again. Relax. We relax, and then you further stretch the foot down, stretching the muscle, and then lift up. 1, 2, 3, 4. Relax. And then a couple more times, we put it in a stretch, and then have the patient lift up. 1, 2, 3, 4. Relax. And then one more time. 1, 2, 3, 4. Relax. Okay, I'm going to take the needles out. And now I'm going to do the fountain of youth muscle stretch technique. Now for this one, this is what we coach our patients to do at home. They can do the stretch themselves by using the left foot and pushing down on the muscle. Now while the patient's doing that, I can have both my hands and I pull on the muscle while it's in a stretch. So we just can walk down and pull on the muscle while it's in a stretch. Good. Okay. And then let's do fountain of youth stretch number 2. So the muscle's in a stretch, and while the muscle's in a stretch, you take your fingers and pull down. Now, we're going to do fountain of youth stretching number 2. Can you sit on your knees? Okay, so this is a stretch. Be careful with the stretch. Some patients may have some knee pain doing this. The quads may be tight, so the patient may not be able to sit fully back on their feet. But go ahead and sit back. So the patient sits back fully on their feet. You'll see that the foot is plantar flexed, thereby stretching the anterior tibialis. So in this position, again, no needles in place. The practitioner simply grabs at the bottom of the foot and then lifts it up, counting 1, 2, 3, 4, relax. Counting 1, 2, 3, 4, relax. Counting 1, 2, 3, 4, relax. And they may feel a tightness. If this muscle's tight, it may be sore at the top of the foot, the tendons. So be very careful with this. They may not be fully able to sit back. They may be restricted in their motion. So you have to be cautious about this stretch. But if they are able to go back as far as they can, and then you just gently lift the foot up. Try not to lift the foot up too much. Just go with whatever the patient comfort level is.
is the anterior tibialis muscle. It runs on the outside of the leg and it attaches to the tendons on the top of the foot and then to the toes. If there is pain on the top of the foot or on the top of the toes, there could be a problem here on this part of the muscle. This part of the muscle is short with knots, and it's causing these tendons to stretch and pull on the tendons here. So in order to get rid of the pain here or here or here, we need to stretch this muscle. I'm going to show you how to do that now. Right now, I'm stretching my foot here. My toes are pointing backwards. And all I'm going to do is take my hand and lift the foot up, counting 1, 2, 3, 4, relax. 1, 2, 3, 4, relax.
This concludes the video. Okay, we're going to do Korean Kinetic Acupuncture technique for the knee procedure. So it's all about balancing the quadriceps on the lateral side and the medial side. Now, one thing about the knee procedure is on the front side around spleen 10, there can be trigger point releasing techniques where the muscle may jump and twitch. So a lot of times on spleen 10, we get trigger point release, which is a good response. It's like the muscle's untying itself of the knots, and it's going to stretch the muscle. But what we're going to do is we're going to find the trigger points along the medial and lateral quadriceps, and then we're going to do the Korean Kinetic knee procedure. Okay, so like I said, right here, quite often we'll get a muscle twitch response. So you can do a little bit of probing with the needle, and you may get the muscle twitch response, and then a little bit on the medial quads. Okay. Are you okay? And just kind of work your way up. Good. Good. And we insert the needles about 1.1 to 0.3 chun. And then once we find the trigger points and all the needles are in place, we're going to do the kinetic procedure. And the first thing we do is we check the patient comfort level. So we're going to bend the knee. Now, if the needles hurt, where does the needle hurt? There's a little dimple right here. That's where the needle can hurt. So we take them out a little bit, and we're going to bend the knee on the inside. Okay, we'll still take them out a little bit. Okay, and then we're going to bend the knee. Is it okay? Relax. Bend the knee, bend all the way. Okay. Okay, so the patient comfort level has been assured. And then what we do is we have the patient lift their lower leg up like that, but we're going to resist that motion. So I'm going to instruct the patient, lift the lower leg up against my hand. Go ahead and push up. 1, 2, 3, 4, relax. And then relax. We can do it from here, push up. 1, 2, 3, 4, relax. So we're putting the quadriceps in a stretch here, and then we're doing the isometric stretch where the patient lifts up the leg. Go ahead and lift up. These muscles contract to lift the leg up, but I'm not letting it, so the only option is they stretch. And you can kind of shake the knee around and move it up and down. And then, okay, and then push up again, please. 1, 2, 3, 4, relax. You can do this about 5 to 10 times. Just push up, 1, 2, 3, 4, relax. Okay, and then we'll take the needles out. Good. And then you could do practitioner choice at this point. And then we do the knee stretch. which I'll show pictures of the knee stretch. So this was the Korean Kinetic procedure for knee pain, releasing the quads to benefit the knee, to realign the knee in proper alignment. Okay, after the Korean Kinetic Acupuncture procedure has been performed, you can teach your patients to do the knee stretch themselves. And don't expect them to bring the foot all the way back where it's touching the butt. In this picture, notice also how my foot is stretched. This is also a stretch of the anterior tibialis muscle. Do you remember that chapter? So this is both a quadricep stretch and an anterior tibialis stretch, just positioning my foot that way. So also you can do the knee stretch, and then the practitioner can pull on the muscle while the muscle's in a stretch. So try that technique out. That's a very effective technique to really straighten out the quadriceps and get a good stretch to realign the knee and give pain relief. This concludes the video chapter on Korean Kinetic Acupuncture for the knee procedure. Next, we're going to kinetic acupuncture for the hip and IT band, tensor fascia latae. So this is for pain on the outside of the hip that the patients may have. And so the first thing is you put the hips in a stretch position. We're going to cross the leg over and the hips in a stretch position. And then we're going to insert the needles on the painful trigger point areas along the IT band. Okay, there's 2 needles right here. They're hard to see. Okay, I'll get a picture of the position here, crossing over, and then push, 1, 2, 3, 4, relax, and then push, 3, 4, relax, push. So all the needles have been in place here. My IT band and my hip is stretched because I've crossed my leg over. Now we're going to do the isometric stretch. And my wife will push the leg over as far as she can. And then I'm going to push with my leg. 1, 2, 3, 4, relax. And return back to stretch. We're stretching these muscles. Now we instruct the patient, push the knee in that direction. 1, 2, 3, 4. These muscles are contracting to move the knee, but she's not letting my leg move. So the only option is they stretch here. So we stretch. Go as far as your patient is able and comfortable, and then push 1, 2, 3, 4, relax. And then again, push 1, 2, 3, 4, relax. This is a sample video demonstration technique for the Korean Kinetic Acupuncture technique. We're going to do a piriformis demonstration. So the patient would be exposed. We're not going to be exposing any part of the body here, but the piriformis generally, it attaches at the greater trochanter of the hip, and then it runs in a kind of triangular pattern to the base of the sacrum and the top of the sacrum, so, or even the coccyx. So it runs in this direction. It's about along the medial glute areas, and so you can find the trigger point areas and insert the needles along the piriformis muscle, just like along a line here and here and here. So then, once the needles are in, you're going to take the patient's leg and interiorly rotate the hip. So right now I'm interiorly rotating the hip. The piriformis muscle stretches by interiorly rotating the hip. I'm going to ask the patient, with the needles in place, to externally rotate the hips by pushing the foot in a medial direction. But I'm going to resist that motion. So if you have your fingers without the needle, you can ask the patient to push. Make sure the patient pushes in this direction, that they're not pushing down towards the ground. So when the patient pushes, you can feel with your finger the piriformis muscle contracting. So go ahead and push. 1, 2, 3, 4, relax. And once again, the patient comfort with the needles has been assured. You've tested the range of motion with the needles in place.
internally rotate the hip. The patient pushes, go in and push. 1, 2, 3, 4, relax. And then you return the hip to interior rotation. Go in and push. 1, 2, 3, 4, relax. Relax. And go in and push. 1, 2. Needling of the quadratus lumborum muscle for lower back pain. So we find the quadratus lumborum muscle. It's centered between the ACIS, anterior superior iliac spine, and the 10th rib. It's positioned right in the middle. Relax your arm. Okay. Okay, so find the ASIS and the 10th rib. Position yourself right here. This is a mapping point. And then run your fingers down to the erector spinae. And it's right there. And then we can needle 1.5 to 2 chun. And you want to needle obliquely. This is obliquely, although in this position it looks like it's perpendicular, but it's really an oblique insertion.
And then after doing the needle, I'm going to do a gentle back stretch. And we just traction the shoulder. We're not pushing, we're just holding in place. And then with your hand, you stretch the back. And do it with the patient breathing. Take a breath in, breathe out, and just gently relax. Good. I like to do this 3 times. Take a breath in, breathe out. Try to relax. Good. And then one more time. Take a breath in and breathe out. Good. So this is therapeutic lumbar technique. It's the QL muscle followed by a back stretch.
This is Dr. Evan Mahoney's kinetic decompression stretch for the lower back, or the kinetic hanging back stretch. We're just going to do a demonstration. This is a demonstration video to support the book Korean Kinetic Acupuncture Technique. This is done after all the back procedures have been finished, and usually the last thing we do for our lower back patients to finish the treatment. I'm going to take this noodle, place it under the arms, double wrap, triple wrap. The more times you wrap around the bar here, the more secure, the more able you'll be able to hold the patient up, and it's easier to hold the patient up the more times you wrap at the top. So when the noodle is in place, you're going to instruct the patient to just bend their knees, and then they're going to walk their feet forward, and they're going to just bend their knees, let the weight of gravity pull and stretch the lower back. Their feet will always be touching the ground. Try not to have them swing or rock. So go ahead and walk forward, and then bend your knees, and just let the weight of gravity pull and stretch the back. The caution is the shoulders. Ensure that the patient comfort with the shoulders is always comfortable, and hold for 10 seconds. If everything's okay, ask, can they feel the back stretch? They should be able to feel the back stretch, and their shoulders should be comfortable. And then 10 seconds passes, stand up, and then have the patient walk in place, lift their legs up as high as they can, ask how does their back feel, and give it a minute or two or a few seconds, and then you're going to repeat the exercise. So let's repeat one more time. Bend your knees, come forward. Bend your knees, let the weight of gravity pull and stretch the back. The patient's not swinging or rocking, and they just let the weight of gravity pull and stretch the back. The shoulders should be comfortable. If not, then instruct them to stand up immediately. Stand up. You were able to feel the back stretch?
Yes.
Okay, good. And walk in place. And then that's how we finish our back treatment. Hello, I'm Dr. Evan Mahoney, your acupuncture pain management specialist and creator of the Fountain of Youth Muscle Stretch series. Today we're going to demonstrate our famous hang from a tree, eliminate back pain stretch. This is a stretch for lower back pain and for the psoas muscle. It is a decompression stretch as well. To explain this stretch, we're going to demonstrate it on the example of the inversion table. Come this way. You may be familiar with the inversion table. You step in it, it's attached at the ankles, and it swings you upside down. It does two things. It separates the vertebrae and it stretches the muscles of the back for pain relief. Well, we can accomplish the same thing as the inversion table with our hanging back stretch. I'm going to demonstrate two stretches. The first is going to be pretty straightforward, while the second I do need to explain a little bit. The second includes the psoas muscle stretch. Now, the psoas muscle is the strongest muscle in the body. The psoas muscle attaches at the 5 lumbar vertebrae here on the lower back. The job of the psoas muscle is to flex the hip like this. So, even though the psoas muscle attaches at the back, it runs very deep down the front of the groin to flex the hip like this. I'm going to use my biceps as an example. As I'm standing straight and upright, my psoas muscle is extended, but if my legs are flexed, my psoas muscle is contracted. Because the psoas muscle is the strongest muscle in the body, if we are in a sitting position, the psoas muscle is contracted, and a very common type of back pain is from the sitting to standing position. And in this case, the psoas muscle is contracted. It may not want to release itself from that position. So in order to stretch the psoas muscle, we have to do the opposite of this, which is this, angling and arching the hip in a backwards direction. So, you can film me. So on stretch number 2 that we're going to show you, we're going to incorporate a psoas muscle stretch using the hang from a tree, eliminate back pain stretch. We're going to demonstrate now.
Okay, cool.
Okay. Before doing this stretch, we advise you to consult with your doctor. If you have a history of shoulder pain, discomfort, injury, then refrain from doing this stretch. If there is any pain in the shoulder or any part of the body doing this stretch, then just pull off and refrain from doing this stretch. So once again, consult with your doctor and avoid if you have any kind of shoulder injury, history of illness, discomfort. We're going to start with stretch number 1 first. I'm standing parallel with the bar. I grab it, I walk my feet in front, and then I just fall back. And I'm just letting the weight of gravity, pull and stretch my lower back to the ground. We're just using gravity to pull and stretch. This was stretch number 1. In my opinion, it's easier on the shoulders. So if there is shoulder discomfort, you may want to try stretch number 1. Stretch number 2, we're going to include the psoas muscle. So, as you can see, right now my left leg, my hip is being arched in a backwards direction. I'm letting the weight of gravity pull the back. I'm relaxing my stomach muscles, just letting the weight of gravity pull and stretch. You can do one leg at a time, you can switch legs, or you can do both legs at the same time, which is what I prefer doing. And you'll see you can do varying angles. Your feet do not have to be so far behind you. They can just be almost vertical underneath you. And this will provide a really good stretch for the lower back. You can read about this stretch in my book, Eliminate Back Pain, Hang from a Tree, available on Amazon.com. You can read my other books as well, Solemn Medical Meditation series. I'm Dr. Evan Mahoney. This is part of the Fountain of Youth Muscle Stretch series. Thank you very much.